Hey, Brad Rhodes coming to you from Lexington, North Carolina. You know, I've been working with people going on Medicare now for a long time. I've been doing it since 1992. That's 30 years ago. And what I have to constantly remind myself of is that, you know, most people are brand new to this process. And Medicare, just Medicare by itself, has a lot of terms and concepts that are kind of foreign to most people. I just had a lady come into my office last week and she said, you know, I think I could understand a lot of this, but the terminology, there's so much to learn. And so it got me thinking, so I wanted to create this, hopefully a quick little video. I'm gonna break this down into 2 videos, but here are the number of things I want to talk about that'll hopefully clear up some of this for you. First of all, I want to talk about all these letters. So what's kind of crazy is why the government makes all these letters and they expect people to understand it. You know, you got Medicare Part A, you got Medicare Part B, Part C, Medicare Part D, okay? Then if people are getting a Medicare supplement plan, most people take out what's called a Plan G or a Plan N, or some people have a Plan F. Yes, very, very confusing. So let's just dive right in here, and let's, up on the screen here, you'll see the first thing you may recognize is this thing called a Medicare Card. Medicare Part A and Medicare Part B. This is kind of what I tell people, this is where it starts. Part A is talking about inpatient hospitalization, okay? You go to the hospital, you got to have Medicare Part A to have coverage for the hospital. So that's Part A, inpatient hospitalization, all right? Part B of Medicare, on your card it says medical. Medical really is talking about doctor's visits, outpatient surgeries, tests, things like that, MRIs, CAT scans, things like that. They may be done at a hospital, but they still fall under Part B because you're not admitted to the hospital. That's what Part A is. So hopefully, so far, that's somewhat clear. Also, when it comes to costs, if you've worked enough quarters, there is no cost to Part A, okay? There's no cost. It's free, or it's what you've paid into. Part B, however, will, the standard premium is $148.50 here in 2021. Some of my clients who have low enough income can actually get that paid for them. And then I've got a number of clients as well that have higher income. Sometimes with higher income, you actually have to pay more than the $148.50. But when you start, and also how do you pay that? Well, if you're drawing Social Security, Medicare will automatically deduct that from your Social Security check, okay? However, a lot of people I talk to these days are working past the age of 65. Maybe that they're going to work till they're 67, 68, or even 70. Well, if you're not drawing Social Security yet, Medicare will bill you for that $148.50. So just know that's the way that works. Okay, so you got Part A, you got Part B. Now, before I get into C and D, I want to put up here on the screen a little chart. And what you see at the top, it's got Medicare, and then it's got Medicare Supplement or Medicare Advantage. The reason I put that up on the screen is that when you're turning 65, and if you're normal, you're going to start getting bombarded by all these insurance companies telling you they're the best one to go with. Well, I always tell people there ain't no perfect answer. What's right for one person may not be right for the other. But the reason I bring this thing up here on the screen is I want to show you something. If you take Medicare, all right, and then you want to get a Medicare supplement plan, and then you need prescription coverage, the prescription coverage, or what's called Medicare Part D, is not covered in the Medicare supplement. You have to get what's called a standalone Part D plan. Okay, remember, this is for people who have Medicare as their primary insurance. They take out a Medicare supplement plan, and then if they want prescription coverage, they take out a separate Part D plan. Okay, hopefully that makes sense. On the other side, if you, instead of taking Medicare and Medicare Supplement, you decide you want to take a Medicare Advantage plan, okay? Another way of saying Medicare Advantage is Part C. Most people don't refer to it as Part C, but the government, that's what they say. They say Medicare Advantage or Part C, okay? The same thing. What's interesting are these Medicare Advantage plans have the Part D, or the prescription coverage, built right in to the Medicare Advantage plan. Most of them anyway do. Some of them you don't have to get prescription coverage built right in, but a lot of people, when they get their Medicare Advantage plan, they have the Part D built right into that plan. The good thing about these videos is you can just watch them over and over again. So I hope that helps. I'm going to cut this video right here. I'm going to stop it. And then the next video, we're going to move into some other concepts of deductibles, co-pays, out-of-pocket maximums and things like that, and the donut hole. So stay tuned.